Hello everyone and welcome. Today we're going to explore the essentials of intravenous therapy, or IV. This is the first slide, so I want to set the stage for what we'll cover. We'll look at what IV therapy is, how it's used, and why it's so important in patient care. I'm excited to take you through this topic, so let's get started. Today, we'll be walking through the outline of our presentation, starting with the introduction. We'll explore when IV therapy is indicated, such as for hydration, medication administration, or nutritional support. Then, we'll look at the different types of intravenous devices used in practice, from peripheral catheters to central lines. Next, we'll discuss the various types of IV solutions, including fluids, electrolytes, and medications. We'll also cover the different methods of infusion, whether it's continuous, intermittent, or bolus. We'll address some common complications associated with IV therapy, like infiltration, infection, or phlebitis, and how to recognize and manage them. Moving on, we'll talk about the importance of monitoring the intake of intravenous fluids to ensure proper balance and avoid overload. We'll also emphasize the nurse's role in caring for patients receiving IV therapy, including assessment, maintenance, and patient comfort. Finally, we'll review key nursing considerations for specific procedures like blood transfusions and administering parenteral nutrition, highlighting safety protocols and best practices. Throughout this presentation, we'll see how these components connect to ensure safe and effective patient care. Welcome to this introduction slide. Here, I want to set the stage for what we'll be exploring together. We'll start by discussing the key points that form the foundation of our presentation. It's important to understand these concepts thoroughly, but I'll also keep the tone conversational to make it easier to follow along. As we go through, I'll highlight the most important ideas to ensure they stand out. Ultimately, this introduction connects directly to the overall theme of our presentation, helping us see how each piece fits into the bigger picture. So, let's dive in and get a clear sense of what's ahead. Now, let's take a closer look at the indications for IV therapy. First, it's essential when we need to maintain normal fluid, nutrient, and electrolyte balance, especially in patients who can't take in enough by mouth. For example, when someone is NPO, nothing by mouth, or during pre- and post-operative periods, IV therapy helps ensure they stay properly nourished and balanced. Next, IV therapy is critical in replacing severe fluid losses. Think of cases like major hemorrhages, severe burns, or dehydration. These situations require rapid and effective fluid replacement to stabilize the patient. It's also used for administering medications directly into the bloodstream, which allows for quick absorption and precise dosing, very important in many treatment scenarios. Another key indication is palliation, where IV medications, particularly analgesics, provide rapid pain relief. This is especially valuable when a patient is in severe pain and needs immediate comfort. Finally, IV therapy plays a vital role in diagnosis. For example, contrast dyes used in imaging procedures like intravenous urograms or pyelograms are injected intravenously to help visualize organs and detect abnormalities. So, in summary, IV therapy is a versatile tool that supports fluid and nutrient replacement, medication delivery, pain management, and diagnostic procedures, all critical components in comprehensive patient care. Now, let's take a closer look at the two main types of vascular access devices. First, we have the central venous access device. This is typically used when we need long-term or large-volume IV therapy, or when other access sites aren't suitable. These devices are inserted into a large vein, usually in the neck, chest, or groin, and they allow us to deliver medications, fluids, or even draw blood easily. They're especially useful in complex cases or when frequent access is needed. Next, we have the peripheral IV, which is probably the most common type you're familiar with. It's inserted into smaller veins, usually in the arms or hands. Peripheral IVs are ideal for short-term use, like administering fluids or medications during a hospital stay. They're quicker to insert and generally less invasive, making them suitable for many routine treatments. Understanding these two types helps us appreciate how we tailor vascular access to meet specific patient needs, whether it's for short-term comfort or long-term management. Both play a vital role in ensuring effective and safe patient care throughout our treatments. Today, let's talk about short catheters, which are typically placed in the extremities, such as the arms or hands. These are generally used when therapy is expected to last less than 6 days. They're a practical choice for short-term treatments because they're easier to insert and remove. However, it's important to remember that these catheters are contraindicated in certain situations. Specifically, they shouldn't be used with continuous vesicants, as these can cause tissue damage if they leak. They're also not suitable for parenteral nutrition, which requires a more stable and longer-term access. Additionally, if the infusate has an osmolarity greater than 900 m osm/L, a short catheter isn't appropriate because of the increased risk of irritation or damage. Keep these points in mind as we consider the best vascular access options for different therapies. Let's take a closer look at the veins of the forearm, starting with the cephalic vein, which is one of the most prominent superficial veins on the lateral side of the forearm and arm. It's commonly used for venipuncture due to its accessibility. Next, we have the median cubital vein, located at the front of the elbow, bridging the cephalic and basilic veins. This vein is often the go-to site for blood draws because it's typically large and stable. Moving on, there's the accessory cephalic vein, which is a smaller vein that runs parallel to the main cephalic vein and can sometimes serve as an alternative access point. The basilic vein is on the medial side of the forearm and arm. It's deeper than the cephalic but still visible and frequently used for venipuncture, especially in the medial cubital area. Within the forearm itself, we also find the median antebrachial vein, which usually runs along the anterior surface of the forearm and can drain into either the basilic or cephalic veins. Finally, under the category of peripheral sites, these veins collectively form the network that allows for various medical procedures like blood draws or IV placements. Recognizing these key veins and their locations is essential for safe and effective vascular access. This understanding ties into the overall theme of vascular anatomy and its practical applications in clinical settings. Let's take a closer look at the veins of the hand. First, we have the digital dorsal veins, which run along the backs of the fingers and help drain blood from the fingertips. Moving inward, the dorsal metacarpal veins are located on the back of the hand and drain blood from the dorsal venous network. Speaking of which, the dorsal venous network is a web of interconnected veins on the back of the hand, playing a key role in venous drainage. Now, two major superficial veins emerge from this network: the cephalic vein, which runs along the thumb side of the arm, and the basilic vein, located on the pinky side. Both veins are important because they are often used for medical procedures like venipuncture. Finally, we see that these veins connect to peripheral sites, meaning they are accessible points on the hand and arm where blood can be drawn or where catheters can be inserted. Recognizing these veins and understanding their pathways is crucial in clinical practice, especially when establishing intravenous access or managing venous circulation. A midline device is a long intravenous catheter that we insert into a peripheral vein, usually in the upper arm. It's typically used for therapies that last between 1 and 4 weeks. The key point here is that it provides a reliable access point for ongoing treatment without needing a central line. The tip of the midline terminates in a peripheral vein below the armpit, which is an important distinction. Unlike central lines, it does not reach a vein near the heart. This makes it safer for administering certain medications and fluids, especially those that don't require central venous access. So, in the context of our overall discussion on vascular access options, midline devices serve as a great balance, offering longer-term access with a lower risk profile for some treatments. Now, let's talk about where these central venous access devices, or CVADs, are typically placed. They are often inserted into large veins such as the internal jugular, subclavian, or femoral veins. The key point here is that the catheter is long enough so that its tip terminates in a great vessel, which ensures reliable access for various treatments. There are three main types of CVADs we need to be familiar with. First, the non-tunneled catheters, which are usually inserted directly into the vein and are often used in emergency or short-term situations. Then, we have tunneled catheters, where the catheter is threaded under the skin before entering the vein, reducing infection risk and making it suitable for longer-term use. Lastly, the implanted devices, which are completely under the skin and are typically used for patients requiring long-term access, like chemotherapy. Understanding these types is crucial because each has its specific indications, benefits, and considerations. They all fall under the broader category of central venous access devices, which are essential tools in modern medicine. This overview helps us appreciate the diversity and versatility of CVADs in clinical practice. Now, let's talk about direct venipuncture through the skin into the internal jugular, subclavian, or femoral veins. This approach is often used for non-tunneled percutaneous catheter placement. Essentially, we insert a needle directly into one of these veins without creating a separate tunnel. This method is typically chosen for quick access, especially in urgent situations, because it allows for rapid placement of central lines. The internal jugular, subclavian, and femoral veins are common targets because they provide straightforward access to the central circulation. It's important to remember that while this technique is effective, it carries some risks, such as infection or injury to surrounding structures. Overall, understanding this approach helps us appreciate the different options available for central venous access, tailored to the patient's needs and clinical circumstances. This slide doesn't contain enough information. That's why we're moving to the next slide. Now, let's take a closer look at surgically inserted catheters. These are typically placed by making a small surgical incision, allowing us direct access to the central veins. The tip of the catheter is inserted through key access points, such as the cephalic vein, or through the internal or external jugular veins. Once in place, the catheter is carefully threaded into the superior vena cava, which is a major vessel that carries blood back to the heart. This method is often chosen for patients who need long-term access, as it provides a reliable route for medications, fluids, or nutrition. When we talk about tunneled catheters specifically, these are designed to be placed under the skin, which helps reduce infection risk and makes them more comfortable for the patient. So, the main points here are the surgical insertion technique, the pathways through which the catheter is inserted, either via cephalic or jugular veins, and the importance of threading the tip into the superior vena cava for optimal function. Understanding these details helps us appreciate how these devices are carefully placed to ensure safety and effectiveness in patient care. Let's talk about the implanted port. This device is primarily used for the infusion of chemotherapy. It's a small device that's implanted under the skin, usually in the chest or arm, and provides easy access to the bloodstream. The key advantage here is that it allows for repeated chemotherapy treatments without the need for multiple needle sticks, which can be quite uncomfortable for patients. This port is especially useful for patients who require long-term treatment because it reduces the trauma of frequent needle insertions and minimizes the risk of infection compared to traditional IV lines. It's connected to a catheter that enters a large vein, allowing medications to be delivered directly into the bloodstream efficiently. Overall, the implanted port plays a crucial role in improving the quality of care and comfort for patients undergoing chemotherapy. It's a vital tool in our arsenal to deliver effective treatment while also considering the patient's comfort and safety. Now, let's talk about some of the complications that can arise with peripheral IV line devices. These complications can be categorized into local and systemic issues. On the local side, we often see infiltration and extravasation, which happen when the IV fluid leaks into the surrounding tissue instead of going into the vein. This can cause swelling and discomfort. Then there's phlebitis, which is inflammation of the vein itself, often presenting as redness, warmth, and tenderness along the vein. Thrombophlebitis combines inflammation with clot formation inside the vein, increasing the risk of more serious issues. Hematoma is another local complication, occurring when blood leaks outside the vessel, leading to a bruise or swelling. Cellulitis, which is an infection of the skin and underlying tissues, can also develop at the insertion site if bacteria enter the wound. Moving on to systemic complications, fluid overload is a concern, especially if too much fluid is administered too quickly, putting strain on the heart and lungs. Air embolism is a rare but serious complication that happens if air enters the bloodstream through the IV line, potentially causing a blockage. Septicemia and other infections are risks when bacteria enter the bloodstream, which can lead to severe systemic infections. Lastly, allergic reactions may occur due to the presence of allergens, such as medications administered through the IV. Recognizing these complications early is crucial because they can significantly impact patient safety and outcomes, reinforcing the importance of vigilant monitoring and proper technique in IV management. Let's talk about infiltration. In this context, infiltration refers to the way external threats or malicious actors gain access to a system or network. It's a critical point because understanding how infiltration occurs helps us develop better defenses. The key here is to recognize that infiltration can happen through various methods, such as phishing, malware, or exploiting vulnerabilities. Once an attacker infiltrates, they can move laterally within the network, potentially causing significant damage. This highlights the importance of layered security measures and continuous monitoring. By focusing on infiltration, we can identify weak points in our defenses and strengthen them, ensuring the overall security of our systems. This concept ties into the broader theme of proactive cybersecurity, where prevention is always better than reaction. Let's talk about extravasation. This occurs when IV fluids or medications accidentally leak out of the vein into the surrounding tissue. It's an important concept because it can lead to tissue damage if not recognized and managed promptly. The key points to remember are that extravasation can happen with any IV, but it's more common with certain types of solutions, especially those that are irritating or hyperosmolar. Symptoms to watch for include swelling, pain, and redness around the IV site. Early detection is crucial to prevent serious complications like tissue necrosis. This ties into our overall focus on patient safety and proper IV management. By understanding extravasation, we can improve our practices to minimize risks and ensure better outcomes for our patients. Now, let's talk about the difference between infiltration and extravasation, which is a key concept in understanding IV therapy complications. Infiltration occurs when the IV fluid leaks into the surrounding tissue, but without the presence of any harmful medication. It usually results in swelling, coolness, and discomfort at the insertion site. On the other hand, extravasation is when a vesicant or a medication that can cause tissue damage leaks into the tissue. This can lead to more serious tissue injury, including necrosis if not identified and managed promptly. Recognizing these differences is crucial because it helps us respond appropriately to prevent complications and ensure patient safety. Remember, while both involve leakage of fluid, the key distinction lies in the type of fluid or medication involved and the potential severity of tissue damage. This understanding ties back to our overall goal of providing safe and effective IV therapy. Now let's talk about phlebitis. Phlebitis is essentially an inflammation of the vein. This condition can occur for various reasons, such as irritation from intravenous lines or infections. When a vein becomes inflamed, it can lead to discomfort, redness, swelling, and sometimes even pain along the affected area. It's important to recognize these signs early because if left untreated, phlebitis can lead to complications like blood clots. In the context of our overall discussion on vascular health and patient care, understanding phlebitis helps us appreciate the importance of proper IV site management and early intervention. Remember, maintaining good aseptic technique and monitoring infusion sites carefully are key steps in preventing this condition. So, always stay vigilant for signs of vein inflammation to ensure prompt and effective care. Let's talk about cellulitis. It's an inflammation of the skin, which means the skin becomes red, swollen, and often tender. This condition typically results from an infection, most commonly caused by bacteria entering through a break in the skin, such as a cut or wound. Cellulitis is important to recognize because it can spread quickly if not treated promptly, leading to more serious complications. The key points to remember are that it affects the skin's deeper layers, causing inflammation, and that prompt medical attention is essential for effective treatment. Understanding cellulitis fits into our overall discussion of skin infections and their impact on health. Recognizing the signs early can help us manage and prevent more serious issues, emphasizing the importance of skin integrity and prompt care when problems arise. Let's talk about hematomas. A hematoma is essentially a localized collection of blood outside the blood vessels, usually caused by trauma or injury. When blood vessels are damaged, blood leaks into the surrounding tissues, forming a swollen, often palpable mass. These can vary in size from small, manageable collections to large, more serious accumulations that may require medical intervention. Hematomas are important to recognize because they can sometimes compress nearby structures or cause complications if not properly managed. In the context of trauma or medical procedures, understanding hematomas helps us anticipate possible complications and plan appropriate treatment. So, always pay attention to signs like swelling, discoloration, and pain, which can indicate the presence of a hematoma. Thrombophlebitis is a condition where a blood clot forms inside a vein, causing it to become inflamed and blocked. Often, this occurs in the legs, which are a common sight due to the increased pressure and blood flow in those veins. It's important to understand that this condition can be uncomfortable and may lead to more serious complications if not properly managed. Recognizing the signs early and knowing the risk factors can help in preventing more severe issues. As we continue exploring vascular conditions, keep in mind how thrombophlebitis fits into the broader picture of vascular health and disease prevention. Now, let's take a closer look at some of the common complications related to central venous access devices, or CVADs. First up is phlebitis, which is inflammation of the vein and can cause discomfort and swelling. Next, we have infiltration and extravasation, where the IV fluid leaks into the surrounding tissue, potentially leading to tissue damage if not addressed quickly. Catheter occlusion is another issue, where the catheter becomes blocked, preventing proper infusion. Venous thrombosis, or blood clot formation in the vein, can also occur and pose serious risks. Infection is always a concern with any invasive device, so strict aseptic technique is vital. Air embolism is a rare but serious complication that happens if air enters the bloodstream, which can be life-threatening. Malposition refers to the catheter being misplaced outside the optimal position, affecting function and safety. Pinch-off syndrome occurs when the catheter is compressed between the clavicle and first rib, which can lead to catheter fracture. Overall, understanding these potential complications helps us better prevent, identify, and manage issues to ensure safe and effective patient care with CVADs. Let's talk about phlebitis. Phlebitis is an inflammation of a vein, often related to IV therapy or catheter use. It's important because it can cause discomfort, swelling, redness, and warmth along the vein. Recognizing early signs is crucial to prevent complications. Phlebitis can be caused by mechanical injury from the catheter, chemical irritation from the IV fluids, or infection. In managing phlebitis, the key is to remove the catheter promptly and apply warm compresses to reduce inflammation. Assessing the site regularly helps catch symptoms early. Also, ensuring proper insertion technique and using the correct catheter size can help prevent it from happening in the first place. Understanding phlebitis connects to the overall theme of safe IV therapy, emphasizing the importance of vigilance and prompt intervention. By doing so, we protect patient comfort and reduce the risk of more serious issues like infection or thrombosis. Let's take a moment to understand infiltration and extravasation, as they are important concepts in IV therapy. Infiltration occurs when non-vesicant solutions leak into the surrounding tissue. These are typically medications or fluids that don't cause tissue damage if they escape the vein. On the other hand, extravasation involves the leakage of vesicant solutions into the tissue. Vesicants are medications that can cause tissue damage or necrosis if they escape into the tissue around the IV site. Both of these issues, whether infiltration or extravasation, are serious because they can lead to tissue injury. That's why it's crucial to monitor IV sites carefully and recognize early signs so we can intervene promptly. Remember, understanding these differences helps us prevent potential complications and ensure patient safety. They are key points in maintaining effective and safe IV therapy. Now, let's talk about catheter occlusion, specifically clot formation. This occurs when fibrin, which is a protein involved in blood clotting, accumulates inside, around, or at the tip of the central venous access device. When this buildup happens, it can block the catheter, preventing proper flow. Essentially, the fibrin acts like a plug that interferes with the catheter's patency, or openness. This is a common issue that can interfere with treatment and needs to be identified and managed promptly. Recognizing these signs early is key to maintaining effective vascular access and ensuring our patients receive the care they need without interruption. Today, let's talk about venous thrombosis. Essentially, this refers to the formation of a blood clot within one or more deep veins. These deep veins are usually found in the legs, but they can also occur in other parts of the body. The key point here is that when a blood clot forms in these deep veins, it can lead to serious complications if not treated promptly. This condition is important to recognize because it ties into overall vascular health and the importance of maintaining proper blood flow. Understanding venous thrombosis helps us appreciate how disruptions in normal blood circulation can have widespread effects on health. Now, let's talk about central line-associated bloodstream infection, or CLABSI for short. This type of infection is confirmed through laboratory tests showing bacteria or fungi in the bloodstream. It specifically occurs in patients who have had a central line in place within the 48 hours before the infection develops. It's important to note that this infection isn't related to an infection at another site, like the urinary tract or wound. Essentially, we're looking at infections that are directly linked to the presence of the central line itself. Recognizing this helps us focus on preventing these infections by maintaining proper line care and hygiene. Understanding CLABSI is a key part of our overall goal to improve patient safety and reduce bloodstream infections associated with invasive devices. Now, let's talk about the Central Line-Associated Bloodstream Infection Bundle, or CLABSI bundle. Essentially, this is a set of evidence-based practices that healthcare providers follow to prevent infections. These infections are quite serious, as they happen when pathogens enter the bloodstream through a central venous catheter. The bundle is usually divided into different components, focusing on three main areas: the insertion of the central line, its maintenance, and ensuring it remains patent or open. By following these practices consistently during each of these stages, we can significantly reduce the risk of infection. It's a comprehensive approach that underscores the importance of adherence to protocols at every step, from placing the line to caring for it daily. This ties into our overall goal of patient safety and infection prevention, emphasizing that a structured, evidence-based approach makes a real difference in clinical outcomes. In this slide, we're looking at a situation where a central line, which was inserted into the right subclavian vein, has migrated upwards into the right internal jugular vein. This is a classic example of malposition. Essentially, instead of remaining in the intended vein, the catheter has shifted into an adjacent vein, which can happen for various reasons. It's important to recognize because malposition can affect the efficacy of the line and may increase the risk of complications. Understanding this helps us ensure proper placement and avoid potential issues down the line. So, always verify the position of central lines carefully after insertion to prevent or address such malpositions promptly. Let's talk about Pinch-Off syndrome. This condition occurs when there's compression of the subclavian catheter between the clavicle and the first rib. Essentially, as the catheter passes through this narrow space, it can get pinched or compressed, which can lead to issues like catheter damage or malfunction. It's important to recognize this because it can compromise the effectiveness of the device and increase the risk of complications. Understanding this mechanism helps us appreciate the importance of proper placement and monitoring of central lines, especially in the context of preventing device-related problems. So, in summary, Pinch-Off syndrome highlights how anatomical structures can impact medical devices, emphasizing the need for careful technique and vigilant follow-up. Let's take a moment to discuss the intake of intravenous fluids. This is a critical aspect of patient management, especially in cases where oral intake isn't possible or sufficient. When we talk about IV fluids, we're essentially providing fluids directly into the bloodstream, which allows for rapid and controlled hydration. It's important to choose the right type and amount of fluid based on the patient's specific needs, such as their electrolyte balance, blood pressure, and overall clinical condition. Monitoring the intake carefully helps us avoid complications like fluid overload or imbalance. Remember, the goal is to maintain optimal hydration and support the patient's recovery process effectively. This ties back into the overall theme of comprehensive patient care, where precise fluid management plays a key role. Now, let's take a closer look at the definition of intravenous fluids. Intravenous fluids are essentially chemically prepared solutions that we administer directly into the intravenous fluid compartment. This method allows for a rapid effect because the fluids are delivered straight into the bloodstream, bypassing other routes of administration. One of the key advantages here is the ability to inject large volumes of fluid quickly, which is often necessary in critical situations. Compared to other methods of administering fluids, intravenous delivery provides a more immediate and controlled way to restore hydration, electrolytes, or medication levels. Understanding this concept is fundamental because it highlights why IV fluids are such a vital tool in medical practice, especially when quick action is needed to stabilize a patient. Now, let's take a closer look at the different types of intravenous solutions. IV solutions can actually be classified based on their nature into three main categories: crystalloids, colloids, and blood products. Crystalloids are the most commonly used. They are solutions that contain small molecules like electrolytes that can easily pass through cell membranes. These are ideal for rehydration and maintaining electrolyte balance. Colloids, on the other hand, contain larger molecules which stay within the blood vessels and help increase blood volume more effectively. They are often used when there's significant blood loss or plasma volume expansion needed. Lastly, blood products include components like whole blood, plasma, and platelets, which are vital when a patient truly needs blood replacement or specific blood components. Understanding these classifications is essential because each type has specific indications and effects, fitting different clinical scenarios. Recognizing which solution to use helps us provide better, targeted care, whether it's fluid replacement, volume expansion, or blood transfusion. This categorization ties into the larger theme of selecting the right therapy for the right patient at the right time. Today, I want to talk about crystalloids, which are often referred to as transparent fluids. These are small molecules that can easily pass through membranes, and they contain essential electrolytes like sodium, potassium, calcium, and chloride. These electrolytes are crucial because they help maintain proper fluid balance and electrical activity in the body. When we classify crystalloids, we do so based on something called osmolarity. Osmolarity is a measure of the total concentration of solute particles in a solution, and it's measured in comparison to blood plasma. This concept is important because it influences how fluids move between compartments in the body, affecting hydration and cellular function. Understanding these key points about crystalloids helps us appreciate their role in fluid therapy, especially in clinical settings where managing fluid balance is vital. So, by grasping the composition and osmolarity of these fluids, we can make more informed decisions about their use in patient care. Now, let's look at the different types of crystalloid solutions. First, we have isotonic solutions. These have the same osmolarity as blood plasma, which means they won't cause fluid shifts between cells and blood. They're often used when we want to expand blood volume without altering the osmotic balance. Common examples include normal saline and lactated ringers, which are staples in many clinical settings. Next, we have hypertonic solutions. These have a higher osmolarity than blood plasma, so they draw water out of cells into the bloodstream. This makes them particularly useful in specific situations, like severe hyponatremia, where we need to rapidly increase sodium levels and volume. Examples include 3% sodium chloride and 5% dextrose in normal saline. Then there are hypotonic solutions. These have lower osmolarity than blood plasma, which means they cause water to move into the cells, rehydrating them. They're often used when we need to treat cellular dehydration or conditions like hypernatremia. Examples include 0.45% sodium chloride and 5% dextrose in water. Understanding these different solutions and their osmolarity helps us make informed choices about fluid therapy, ensuring we match the right solution to the patient's specific needs. This slide doesn't contain enough information. That's why we're moving to the next slide. Now let's talk about colloids. These are large proteins and molecules that, unlike smaller particles, cannot pass through the walls of the capillaries and reach the cells. Because of their size, they tend to stay within the blood vessels for a longer period. This makes them particularly useful when we want to increase the volume of blood or intravascular volume, which is essential in cases of significant blood loss or dehydration. It's important to remember that colloids have specific storage requirements and a relatively short shelf life, so they need to be handled carefully and used within a certain time frame. Some common colloid solutions you'll encounter include plasma protein fraction, dextrin, and hedaestarch. These are often chosen based on the patient's needs and the clinical situation, especially when we need to quickly expand blood volume. Overall, colloids play a critical role in fluid management, especially when we need to maintain blood pressure and ensure adequate circulation. Now let's take a closer look at the different blood components and their specific roles. First, we have whole blood, which is particularly useful in cases of hemorrhage because it provides all the necessary elements to replace lost blood volume and components. Next, packed red blood cells, or RBCs, are mainly used to treat anemia, where the patient's red cell count is low, helping to restore oxygen-carrying capacity. Moving on, white blood cells, or WBCs, play a crucial role in fighting infections. They are an essential part of our immune response, especially in patients with compromised immunity or infections. Platelets are another vital component. They are key players in initiating blood clotting, particularly in conditions like thrombocytopenia, where platelet counts are dangerously low. Then we have fresh frozen plasma, or FFP, which provides clotting factors. This is especially important for patients with coagulation deficiencies who are bleeding or at risk of bleeding. Lastly, albumin is a plasma protein that helps maintain blood volume and pressure, and it can also be used in various clinical situations to restore plasma volume. Understanding these components highlights how diverse and specialized blood products are, each tailored to address specific clinical needs, reinforcing the importance of targeted transfusion therapy in medical practice. Now let's talk about parenteral nutrition, also known as hyperalimentation. This is a method of providing essential nutrients directly into the bloodstream through an IV, which includes proteins, carbohydrates, fats, vitamins, and minerals. It's a vital support when the gastrointestinal tract can't be used effectively. Parenteral nutrition can be either partial, called PPN, or total, known as TPN. The key difference is the extent of nutritional support. Partial supplements some needs, while total replaces all nutritional intake. Moving on to clinical indications, parenteral nutrition is mainly used when a patient cannot tolerate enteral feeding. For example, in cases of paralytic ileus, intestinal obstruction, or persistent vomiting, the gut simply can't handle nutrients. It's also crucial for patients in a hypermetabolic state, such as those with burns or cancer, where the body's energy demands are significantly increased. Additionally, it's indicated for patients at risk of malnutrition. This includes those who have experienced recent weight loss of more than 10%, or NPO, meaning nothing by mouth, for over 5 days, or are preoperative patients with severely depleted nutritional reserves. So, in essence, parenteral nutrition is a life-saving option for patients who can't meet their nutritional needs through the gastrointestinal tract, ensuring they receive the vital nutrients they need to recover and maintain health. Let's take a closer look at infusion methods. When it comes to delivering medications or fluids directly into the bloodstream, there are several key approaches to consider. Each method has its own advantages and specific use cases, and understanding these is crucial for effective patient care. First, we have continuous infusion, which involves administering a steady flow of medication over a set period. This method is ideal for maintaining consistent blood levels of a drug, especially in cases like pain management or critical care. Next is intermittent infusion, where doses are given at specific intervals, allowing for periods without medication. This approach can help reduce potential side effects and is often used with antibiotics or other medications that don't require constant levels. Then there's bolus infusion, which involves delivering a single, concentrated dose rapidly. This is useful in emergency situations where immediate effect is needed, such as administering epinephrine during a cardiac arrest. Finally, we also have patient-controlled infusion systems, which empower patients to manage their own pain relief within prescribed limits. This method can improve comfort and satisfaction by giving patients a sense of control over their treatment. Connecting this all back to our overall theme, understanding these infusion methods enables us to tailor treatments to each patient's specific needs, optimize outcomes, and ensure safety. Let's talk about the different methods of administering medications. First, we have intermittent delivery, which involves giving doses at specific intervals. This method is useful when you need controlled, periodic medication levels. Next is continuous drip, where the medication is infused steadily over a set period, providing a constant level in the bloodstream, which is especially important for drugs that require steady plasma concentrations. Then there's the bolus, or shot, which is a quick, concentrated dose given all at once. This method is typically used in emergencies or when rapid effects are needed. Understanding these different methods helps us tailor treatments to achieve the best outcomes for our patients, ensuring the medication is delivered effectively and safely according to the specific clinical situation. Now, let's walk through the nurse's role when caring for a patient receiving IV therapy. First, it's essential to assess the solution itself, making sure it's clear and not expired. Using an IV solution that's compromised can lead to complications, so always check the date and clarity before hanging the bag. Next, securely tape the IV bottle or bag in place. I like to use adhesive tape alongside the fluid container, especially on the fluid indicator tape, to ensure it stays secure and visible. Proper labeling is also crucial. You should label the IV container with the patient's name, the solution name, the volume, the time span for infusion, the ordered rate, the start and expected end times, any drugs added, and your initials. This helps prevent errors and keeps everything transparent. When hanging the IV, make sure the bag or bottle is at least 36 inches, or about 90 centimeters, above the insertion site. This height ensures proper gravity flow and consistent delivery of fluids. Now, a key part of safety is checking the medication administration rights. Always verify the right patient, medication, dose, time, route, and documentation. Never skip this step. It's vital for patient safety. Moving on, inspect the IV site for signs of local complications like redness, swelling, or pain, which could indicate infiltration or infection. It's equally important to check the patient's vital signs to identify any systemic responses, such as allergic reactions or signs of overload. Finally, don't forget to follow up on intake and output. Keeping an accurate fluids chart balance helps monitor how well the patient is tolerating their therapy and ensures proper fluid management. By paying attention to these details, we help ensure safe and effective IV therapy for our patients. Let's talk about IV container management. It should be changed when it's empty, which is before the fluid level drops below the point of the trocar in the neck of the container. Also, if there's a change in IV orders, or if the container has been hanging for more than 24 hours, it's time to replace it. Now, regarding the IV set, it should be changed every 24 hours to reduce the risk of infection and ensure proper functioning. It's important to regularly inspect and palpate the insertion site for tenderness, ideally every shift or daily, to catch any signs of complications early. For peripheral access, the catheter should be changed every 72 hours or sooner if needed, especially if there are signs of infection or infiltration. And finally, most peripheral IV lines are flushed with saline, about 2 to 3 milliliters of 0.9% normal saline, before and after administering medications, and every 8 hours when no medications are being given. All these steps are crucial in maintaining safety and preventing complications, which ties back to our overall goal of providing quality patient care. This slide doesn't contain enough information. That's why we're moving to the next slide. When preparing for a blood transfusion, it's crucial to verify the blood group and check the expiration date carefully. Always reject the blood if it looks dark black or if you notice any gas bubbles inside, as these could indicate contamination or spoilage. For access, make sure you're using a large enough device, typically 18 gauge or larger, to facilitate a safe and efficient transfusion. Throughout the process, it's important to regularly assess the patient for any signs of a transfusion reaction, such as fever, chills, or rash. Remember, never shake or squeeze the blood container, as this can damage the blood cells and compromise safety. When it comes to timing, packed red blood cells and whole blood should be infused within 4 hours of leaving the blood bank to minimize the risk of bacterial growth. For platelets, the infusion should be as rapid as possible, usually over about 10 minutes per unit, and always with a special platelet administration set that contains a filter to ensure safety. Fresh frozen plasma should be infused within 15 to 30 minutes, while cryoprecipitate needs to be infused more quickly, within 3 to 15 minutes. These considerations are vital to ensure the safety and effectiveness of blood transfusions, aligning with our overall goal of providing the best patient care. When preparing to administer parenteral nutrition, it's important to start by removing the nutrient solution from the refrigerator at least 1 hour before use. This helps the solution reach room temperature, reducing discomfort and potential complications for the patient. Before administering, always check the solution for any signs of fluid separation, such as cracking or creaming, which indicates the solution may be compromised and should not be used. The solution is administered through tubing that includes an inline filter, which helps prevent particulate contamination and ensures safety. Typically, the infusion is delivered at a consistent rate over a 24-hour period to maintain stable blood levels and avoid fluctuations. To ensure accuracy, using an electronic control device can help regulate the rate precisely, which is especially important for patient safety. It's also crucial to change the solution container and tubing every 24 hours to prevent contamination and infection. Daily weight monitoring is essential to assess the patient's response and nutritional status, and blood glucose levels should be checked regularly to prevent hyperglycemia. Keep a close eye on intake and urine output to monitor fluid balance and kidney function. When handling fat emulsions, avoid shaking the bottles excessively, as this can cause emulsification issues. Fat emulsions are typically infused over 4 hours, whereas 20% fats are usually infused over 6 hours. Following these considerations ensures safe, effective administration of parenteral nutrition, which plays a vital role in supporting patients' recovery and overall health. Let's take a moment to look at peripheral cannula sizes. These sizes are crucial because they determine the flow rate and compatibility with the patient's needs. Choosing the right size ensures effective infusion therapy while minimizing discomfort and complications. Generally, smaller sizes, like 24 or 22 gauge, are suitable for most medications and fluids, especially when the patient has fragile veins. Larger sizes, such as 20 or 18 gauge, are used when higher flow rates are necessary, for example, in emergency situations or for rapid infusion. It's important to match the cannula size to the treatment requirement, always keeping patient safety and comfort in mind. This understanding of sizes ties back to the overall theme of providing safe, effective, and patient-centered vascular access. Making informed choices about cannula sizes helps optimize outcomes and reduce potential complications. This slide doesn't contain enough information. That's why we're moving to the next slide.